Welcome to the NASM CPT podcast and our Facebook Live webcast. My name is Richey, and I want to thank you and welcome you for being here with us today. And today we have a wonderful guest I'm really quite excited about. It was at Optima either last year or the year before that I had seen Dr. Scott Cheatham speak. And was really quite fond of him and the work that he's done. And we had some opportunities to actually meet and work together on some projects. And one of those projects is the newest version, the newest iteration of the NASM corrective exercise specialist. So he is not just a subject matter expert for us on that. He did a lot more. His roles and responsibilities for helping us develop that and roll that out were really much bigger than what they think they started you at. But with that being said, I want to welcome Dr. Scott Cheatham. Thanks for being here.
Yeah, hey, Rick, thank you. And I want to thank you for allowing me to be on this podcast because, to be honest, I feel complete now. Yep. That I'm part of your podcast. I do. You had me at hello. No, I am just kidding. But yeah, no, I'm just excited to be here and, just to chat and just have some fun and talk about, some of the topics that we have, but also be with the NASM family and just kind of sharing stuff. So I just hope everyone out there's being safe and healthy during this time. So.
Hey, thanks a lot, man. Thank you. So I guess one of the questions I initially have for you is you brought up this idea of one of the research studies that you're working on right now, and it has to do with balance. And that really piqued my interest because I happened to be doing an actual workshop at Optima this year, 2020, on balance because it's all throughout the OPT model, as you know. And so when you said you were doing some work on balance, I said, I can't wait to have this discussion because maybe I'll learn something so I can go and teach some extra stuff over at Optima that I hadn't planned on. So before we get into the actual study, can you just tell me, how do you come up with the ideas that you end up doing research on? And this is not your first rodeo. You've done multiple research studies. Like what kind of pokes you and says this is the direction to go in?
Well, I think, that's a hard question because, even though I teach and I do research and stuff, I still have a thriving clinical practice. So I don't know about all of our family out there listening to the podcast, but I don't know about you guys, but I when I see something in the clinic that I don't know, or if I have a question, it comes up. And so a lot of my stimulus to create these studies or create these clinical questions for these studies is questions that I can't answer in the clinic, and I'm seeing this with clients and at all different levels and stuff. So a lot of my more recent research was, is just trying to find out these practical questions that'll make our client sessions and our treatments, if you're an allied health professional, or your fitness assessment and your fitness training better, so.
Well, can you get us into a little bit about what this research study was? What happened with this one? Why did you choose to go into this particular topic?
Okay, well, I think it's interesting because the study we did was on a concept called balance confidence. And, this has been a very popular kind of area of study for older individuals. And I don't want to put everyone to sleep this morning, but just kind of looking at the research for older individuals, the majority of the research has found that if an older person is confident with static or dynamic movements, there is a decreased risk of falling. And so I thought that was interesting because when we look at that concept, and if we do, like, let's say vestibular rehabilitation, or if we do balance training, a lot of times in the clinic or the gym setting, we use all the unstable objects, right? The famous BOSU, or we use the air-filled discs. We use the foam pad, and there's the wobble board and the voodoo board. There's all these different props that we use. But the thing is that when we talk about younger populations and we talk about, like, let's say the OPT model, and we start with, phase 1 and move to phase 5 with our clients, we typically use a lot of these unstable objects just to kind of switch it up and just kind of have fun with our clients and stuff. Well, one thing I've noticed over time is that when I started doing rehabilitation on athletes with like ACL repairs, right? During my rehabilitation being an ortho PT, and also like ankle sprains and stuff, every time we put them on an unstable object, it took a couple sessions for them to build that confidence. Okay. And so I believe one of the psychological barriers could be that if someone's not confident with the object, like for example, Rick, like if you and I were walking, all of a sudden we were walking the snow and then we hit like an ice patch, we kind of all of a sudden go into that ready squat position, right? And then we're kind of finding our way. Well, over the years, I've seen that when someone gets put on, like, let's say a BOSU, all of a sudden they're in that crouch position. They're looking straight ahead, and they won't even look at you. Remember that? They have to pick something on the wall and balance, and they don't acknowledge you, and they're just sitting there. And so that came up with the idea of saying, okay, well, how does this concept that's very popular in the elderly population translate to a younger active population? So we looked at, and I'll kind of branch of the study a little bit. We looked at two things. We looked at anticipated, which, we looked at anticipated versus actual. And so what we did is we took 5 common objects. We did the ground, the foam pad, the discs, a balance board, and a BOSU. And so we tested 65 active adults with no injuries. And then during phase 1 of the study, we sent everybody a survey that showed the pictures. And we had them rate their confidence, just checking them out, like, oh yeah, that one's easy, and stuff like that. And then we did what's called a washout period, where we give them a week off of the study so that they can kind of forget things and function. And then we had each of them come back, and then we had each of them actually stand 2 leg and 1 leg, so bilateral and unilateral, on each object, and then rate their confidence again. And so we were trying to do anticipated and actual real confidence, because, believe it or not, just kind of a side note, there's quite a bit of research out there that shows that active adults get injured in gyms because they overestimate the exercises. And I think we've seen that with our clients. Like, they just grab a bunch of dumbbells and start working out. But there's actually some studies out there that show that injury rates are high when it comes to like machinery and clients doing things. So that kind of set us up. And so, just kind of in short, we found that obviously the anticipated was a lot more higher because people were a lot more confident with these unstable objects than they were actually. So it was the first in a series of studies that we're doing. But looking at balanced confidence, we found that the actual, that them actually trying it seems to be a better qualitative thing. So the take home here is for like, fit pros and allied health professionals, it's better for the client to possibly do a trial on the object first. And then, and then we used a 0 to 10 scale for them to measure their balanced confidence. And then that kind of gauged how we can progress or regress the activity through this construct. And
I do have a question. Is this indicating that that people seem, maybe they're more confident before they get on this object, and when they get on the object, suddenly they're hit with a bout of humility, that these objects are maybe a bit more than they expected? Is that what you're saying?
Yes, exactly. Yeah. And again, when the study comes out, it's a little bit more clear, but yes, exactly. So when people get on the objects, they automatically became fearful, and then they started doing all their balance strategies, right? Their hips are moving, their ankles are moving. And so, because if you look at a lot of the research, Rick, on the performance of athletes on all these balance objects. It's all about observable performance. It's not, there's nothing in the research that's considering the person's psychological perception, their confidence with that.
What are they usually, qualitatively, what are they usually trying to answer then?
Well,
sorry, I say, because I know I read through the proposed research study, and one of the things that was said is that, they want to know if they feel confident to go back to play, right? So to go back to their sport. Are there other things that they have been kind of looking at, and this is the first time you've looked at confidence for balance?
Yeah, so a lot of times they're looking at more of like motor control stability. It's pretty interesting. So these researchers were looking at any type of like a single leg squat. They're looking at the depth jump, single leg hops. They were looking at more of a motor control strategy, but they never looked at the correlation between the confidence during the rehabilitation and then the confidence as the athlete returns to play. And so I think that translates over to our normal clients, because that can open a motor neural window, if they're confident with the object, to build more and progress them along.
Now, there is a question, at least I think in the research, as to whether or not, and you alluded to it in the beginning, but as to whether or not these tools that we're talking about actually help support people in their balance. What have you seen in regard to that? And, what are the purposes of using these tools? Do they relate back to assisting somebody with balance that is on a stable surface? And if it doesn't, then why do these modalities get implemented?
Yeah, I think that's a great question. So I think the first thing is, and I think it's important to bring up, is the term balance is such a broad term, as you know, right? And I think the NASM family will realize that if you read different research articles or different periodicals or different things, the term balance is used for many different things. But if we go back to the science, we know that balance is a compilation of three physiological systems, right? It's our eyes, because we have to see what we're doing. That works with our inner ears, which is our vestibular system. And then obviously we have our somatosensory system, which we typically call proprioception, right? So those three systems work in unison to give us that balance. And so a lot of this research has just used these unstable objects without truly defining balance, and looking at the translation to function is what you're alluding to. And so a lot of these modalities are used just for fun and stuff. But if we go back to the research and we kind of look, and I don't want to get too nerdy today, but if we kind of go back and look, we can see though that if we look at the squat, right, there's been some really good research coming out that has showed that if you squat on an unstable object, the power of the movement decreases compared to a stable surface, right? And one thing we talk about is when someone's standing on an unstable object, we call it leaking energy out. Does that make sense? So if someone's having these big perturbations and they're shaking everywhere and stuff, they're leaking energy elsewhere, and they're not translating energy through their feet with like a closed chain activity. And so a lot of the research shows that on an unstable object, you are getting multiple muscles contracting because that co-contraction for stability, but you don't generate power. So a lot of this research doesn't have a clear purpose. And so that's where I think people are getting mixed up, because we all want to use these modalities to make it fun for our clients. But again, we go back to the SMART goals, right? And we have to say, hey, what is the goal of this exercise? And that's the art of training people. You know that, right? Connecting the modality with the purpose. And so to me, those are kind of the strengths and limitations. And so just kind of in summary, there's really little translation right now to say, okay, I can have someone stand on a BOSU for 2 months and that their gait's going to be great. Does that make sense? Yeah, they're going to skip, they're going to skip on out of the gym, like that. So, right? I mean, or, they're going to do river dance or whatever, right? After the BOSU, which I'm a fan of river dance. Nothing wrong with that. But yeah. So yeah, so that's kind of in short. I'm not trying to get too nerdy, but yeah, it's a lot to it.
Yeah. Well, I remember I'm going to share a story about my dad. This was probably 10 years ago, and he lives where I grew up. So my mom and dad are still there in a place called Florence, Alabama. And my dad says to me one day, he goes, "Rick, the city of Florence gave us these big garbage cans. And we got to put our trash in these big garbage cans. I got to take them out to the street, and then they can use the machine and dump it, and they put it back down. I bring it back down to the garage." So I rolled that can up the hill, and I got to the street. And he goes, "Son, my balance has gotten so bad that I didn't leave the garbage can there. I had to walk back down with it so I have something to hold on to." And I said, "Wow, man, you talk about taking for granted things that you just have until you realize you've lost it, and then how scary that can be." And I had him just quick assessment. Can you stand on one leg and, hold on, get close to something. And as anybody does, he did his best leg first, and it was terrible. And then I said, "Let me see your other leg." And he could barely pull his other leg off the ground. He was scared to. So now we're looking at that confidence again. And this is kind of what you were talking about, except the folks that you were doing this with were about 24 years old. And my dad at the time was in his, I think he was in his early to mid 60s. So not even that old. And he was getting very, very concerned. He was very apprehensive regarding his balance. I don't want people with bad balance to be cavalier about it, right? Like people seeing the disc or the foam pads and then looking at it and going, "Oh, I can do that." But when you actually try it, you can't. Can this research kind of make any correlation with, my dad's perceived confidence and what's going on with him, and clearly something for him to be aware of? And as he builds his confidence, does that actually relate to better balance?
Wow, you're asking all the hot questions today, huh?
Yeah.
I love it. Yeah.
And listen, I know that it's not what you studied. It's not what the research is about. Yeah. And I know it's just speculation unless we have evidence to show it. So just,
Yeah, no, I like it. Dr. Richey, I love the questions. No, so a couple things. So first thing is, as far as research and stuff, yeah, we needed, my group, we needed to figure out how the engine works. So that's why we did healthy people first. So our next study that we had, and it was about to start before the COVID came out, was we were going to compare older individuals to a injured population. So Achilles tendinosis. So we were going to compare those. So we're going to hopefully have some answers about that too. Now, talking just plainly though, I think there is some translation, because when we look at the whole idea of what's called fear avoidance or, confidence issues in individuals and stuff like that, typically someone's confidence almost drops by greater than 50% after one or two falls. Does that make sense? Okay. So when we look at the older population, like, I don't know, 65 or older, a lot of times they're more sedentary, they're not as active and stuff like that. They have these postural syndromes and stuff like that. So a lot of their body isn't as mobile as it was. And so you have this whole musculoskeletal kind of decline. Well, that obviously affects balance, right? Because balance is all the receptors, and it's musculoskeletal. So it is true, though, that we do see a decline in confidence in general as people get older. And so that's why there's such a push right now. And I'm sure, you're on it like I am. That's why we're trying to disseminate the information, is that, balance has to begin at the early ages and continue all the way through. Because, if we like it or not, if we're carrying groceries up the stairs, right? If we're rehabbing an ankle sprain, whatever scenario you want to come up with, we use balance, proprioception, whatever we want to call it, all the time. And so it's a system that doesn't go away, but as everyone knows, if you don't use it, you lose it, right? And so, I think what you're saying is totally true. The research is getting there, but I don't have any definitive citations that I could give the team this morning to say, oh, okay, this is one study. But clinically, yeah, we see it all the time. I have older individuals where their balances get better when they stand on an object for a month or so. You know what I mean? It's pretty obvious, but now we're trying to look at more of the whole psychosocial, the whole, biomedical model to help us look at the whole person,
Now, this is one of the things that is included, and I think brilliantly within the OPT model, is that it doesn't matter what level you're in or what phase you're in, there are balance components to it. And sometimes, in my estimation, it gets overlooked and people just kind of brush it under the rug because it doesn't feel like exercise until they come to class with me. and I am notorious for doing, as one person once called it, the single leg excursions of death. So taking these single leg excursions and challenging your sense of balance so much, and it doesn't take much. That's the thing. Before you feel your feet start working, which, let's be honest, we basically cast our feet from the time our children are born. And so these intrinsic muscles in the feet aren't really doing as much as they normally would be doing. Foot and ankle, the same thing. Hips then are compensating. So what we're doing is we do single leg exercises in particular. You have this core activation, the hip activation, the foot and ankle complex, all trying to have conversations with each other and then maintain that center of balance, and that and base of support right there. So with that being said, I challenge balance, and I make balance feel like a workout. It is a piece of the OPT model, and it's not just a warm up. It actually can get you it can be quite exhausting, quite challenging. What have we seen, or have you seen with either the folks that you worked with or some of the research that shows, our fit principle here? What is the frequency that people used within the research to see some of good outcomes? What were some of the intensities? How long did they do it? How many times a week did they come in? How long were the studies? Before you start to see an average of where it's beneficial for people regarding balance.
Yeah, again, awesome questions. I love it. So yeah, so I think too, it's at least from my humble perspective, is that when we take our typical training session with our clients, balance typically begins with a warm up. Like if we're doing dynamic warm ups and they're standing on one leg, that's a form of balance. You agree? And then I think as we go through and we do single leg squats, we might do some type of plyometric stuff. To me, those are all balanced type of exercises. And so the OPT model stacks on itself like a bunch of blocks. And if you don't build the foundation, right, and phase 1 and 2, how can you safely progress for 3, 4, and 5? And so on that note, we know with basic science that neurological return or better motor control, or if we want to get all biomechanical and nerdy, we can say stability. So like let's say, for example, someone's doing a single leg balance on a disc, like the air-filled disc, and we're looking at their core, and they're shaky and they're doing that hip strategy. They're swaying everywhere. They're leaking energy. The knee and the ankle strategy are going. They're not very confident. Well, then we know that exercise could be a little bit too advanced. So we may need to regress them down to the foam. And then all of a sudden with the foam, we notice that those blocks stack up, right? That their kinetic chain, all those kinetic checkpoints are starting to line up well. And you're like, wow, okay, they're demonstrating more stability. So then from there, we know that if they continue with that exercise and they feel confident, because that's why we use the 0 to 10, if they're feeling confident, and let's say 10 is not confident, 1 is 100% confident, or whatever scale people want to do it. Once they clear that, then you progress them to the next object. Well, we know in the research, and I'm kind of connecting this, try to be practical, is that we know around 4 weeks you get neurological return. So we're starting to see throughout the research and more so clinically that around 4 to 6 weeks we start seeing adaptations occur in the neuromyofascial system. Does that make sense? And so when we get that 4 weeks of return, we start seeing that people are demonstrating better stability, they have better motor control, they're not so shaky, and their confidence goes up. Okay.
Yeah. So let me ask you another question, because we get this a lot as instructors teaching workshops, especially when we talk about doing assessments. People always want to know, well, how much do you cue somebody into the assessment? So my question for you is, when you get somebody on there, how much cueing is going on? Are you telling them to tighten anything, or are you just having them get on there and say, stay on it as long as you can?
Yeah, that's a great question, because there's research that has used the 3 systems in the vestibular, right? I mean, the 3 systems in balance. So there's been studies that had people gaze at an object. So they fixed, right? So they fixed vision, and then somatosensory and vestibular had to work harder. So there's been studies that have played with the 3 systems of balance. What we try to do is in our study currently, and what I do is I just have them stand on the object and see how confident they are. Because people, because it was funny, because a lot of people in the study were young and they were active, and they had used, one of our criteria was they had used a balance object within like the last, I don't know, it was like 16 or 18 months, if I recall. And some of them were pretty confident, like on the wobble board. I'm like, okay, Rambo, go get him, like that. And they're like, whoa, and I'm like, ooh, that confidence went down, and I'm just kidding. But we had some really young, fit people in the study. And I'm like, okay, go get them. And it was funny because, obviously we were right next to them to protect them, but we had some good laughs too, because we had a lot of young adults from the university and they're super fit. Well, they thought that they could stand on that Bosu, how we flip it over with the base up. They thought that they were the coolest thing, I can serve, and so it was fun. So I think if we're doing a true assessment, unfortunately in the research, there's really no time period when we look at the fit principle. So when we look at frequency, usually it's kind of daily, right? When we look at intensity, it's really the object and stability. That's really what we're really looking at. When we look at time and the different parameters and stuff, for some reason, 60 seconds seems to be the magical time. We do a plank for 60 seconds. Everything's 1 minute. I don't know why, but I use it too. And I do 3 sets of 10. Have you noticed that every physical therapist on this earth does 3 sets of 10? I know, I'm just kidding. But yeah, I'm gonna get a bunch of emails now from my colleagues like, dude, what are you doing? But no, it's so funny. So 60 seconds seems to be this magical number when it comes to balance. So when we talk about the fit principle, probably the first couple letters are relevant. The other ones are kind of up to the client. I mean, if the client's fatiguing and they're showing a lot of instability, safety's first, because we know too that injuries can occur. Does that make sense? And when someone's on an unstable object, you need to stand close to them, and you need to be at least what's called a contact guard assist, when you're right there and you protect them and stuff. So seriously speaking, a lot of these unstable objects, they're great to do, but it should really reflect the client's goals, right? And that's just in my humble opinion. And we teach it, and we embedded it in the CES when we did that and stuff. But we really need to have a purpose for these modalities and stuff. They're all great and stuff. It's fun to switch it up. But if we're really working on someone's balance, then the fitness professional needs to go back to some type of of what we call an asterisk sign or some type of assessment. So if they're working on a better gait, well, then the balanced exercises should be gait related. Does that make sense? It's got to have a purpose. If we're working on an athlete who is, they don't have a very good single leg squat, okay, well, then your assessment after all the balance training should be an improved single leg squat. Does that make sense? So the assessment has to support the balance intervention. And then you do a pre-test and a post-test to look at your results. And that's what research is mostly about, right? We have to look at before and after. So I think just kind of talking amongst our colleagues who are listening today is this, I just recommend, that if you're going to be doing balance and stuff just for fun, no big deal. Do it for 60 seconds, make sure that they're stable. You can go from, you can do the eyes closed to progress it. You can have them move their head. You can throw a ball at them. You can play dodgeball, right? You can bean them or whatever. Or I'm kidding, but you can
dodgeball.
Exactly, totally, dude. We need to get out videos and stuff. So yeah, be creative, but just be safe, right? And one other thing I want to embed in there too is remember, and I think it's important to realize too is that you want to screen the client before you start putting them on objects. That's the whole point of balanced confidence, is that they want to be confident, but also too, like if they've had a history of ankle sprains, okay, you got to be careful, put them, yeah. And I think this is a good reminder, and I even do it for myself, is that, you might need to put a brace on their ankle just to protect them before they do a bunch of balance stuff. So like I have a couple ankle sprains I'm working with right now currently because they're essential. They had surgery and all that. Well, if we're starting balance, I made sure that before I put them on an object, yes, I look at their confidence, but also I make sure that they've been stable on the ground. Then they did the foam pad. So what also part of our study is we also did a sub-assessment where we kind of looked at perceptions of what's easy and hard. And it was pretty obvious. The ground's easy, then the foam pad, then the discs, then BOSU. It kind of goes like that. But I recommend for everybody, start easy and progress slowly. But also, though, too, if they have a musculoskeletal injury where they're unstable, you want to be really careful because you don't want to have an injury because, as we want to protect our clients as much as possible, but also make the session fun and create an experience for them. And so that's I think is kind of why balanced confidence was that, we want to dig a little bit deeper into the psychology of things because that's where the industry is going. And that there's so many things it's looking at: confidence, pain, how we perceive things, rest, regeneration. There's so many constructs. Well, one thing that hasn't been touched is how is confidence, feeding into someone's program. And we use these balance tools so much every day. We need to look at it, I think, so.
I think we also need to be aware and careful that when we do things in front of a lot of people, in a gym, like an open gym, then there are people that want to emulate us and do what we do and do what clients do. And if we're having people go onto these unstable objects, we have to be careful that other people in the gym might see what we're doing and just gravitate towards it. And I say this out of experience because years ago when I first started training, it was functional training then to in the personal training world was like, put a balance blade in one hand and an eye patch on and stand on a stability ball and wiggle and shake and close your eyes and recite French backwards. And there are all sorts of things that as we made balance challenging, then that was, quote, functional training. Now, we know that that's not true, but being in that environment where we're all challenging each other, standing on stability balls and throwing med balls at each other, seeing who would fall off first, which I don't recommend. And I don't recommend doing it in front of people because one of the members at the gym said, can you teach me how to do that? And I said, you know what, it's just games. Like, this is just fun and games. I'm not going to teach you how to do it because there's no reason anybody in their right mind should do it. And he said, okay. And I turned around and walked away. And 15 seconds later, not even, I hear a giant thunk onto the ground. And I turn around, and this man is lying face up on the ground. And he goes, "You were right." So with that being said, I think it's important for us to be aware of what we do, how we do it, the words that we use, and that people are seeing us do things, and we do need to make sure that we are careful as we present things, that things that are this challenging are not just for everybody. And this isn't really a question to you, it's just a conversation to have. I don't know what being careful around that looks like, but I do know that other people may challenge themselves with it. And so maybe it is very important for people to see us do progressions with our clients. So if they do decide to do some of these things, then maybe they, when they take it into their own hands, will try it, at least as far as this is concerned, the progressions that we put forth. I don't know what your thoughts are on that, but just want to throw that out there.
No, and I think that's a great point because, the visibility of a fitness professional, we're always on TV, right? When we're in the gym, when we're out in public and stuff. So, and it's funny because, I interface with a lot of different professionals. And I'm telling you, it's funny because we talk all the science and we take all these CE classes and we have all these certifications and we have all these letters behind our name for each other because the clients don't give a care, right? They don't know what it is. But the thing is that when it comes down to it, a lot of times we're so busy, we just pick an object and we put someone on it. Okay. And then people replicate that. And as you know, too, I do a lot of work with all the big chain gyms and stuff. But as you remember, a few years ago, it was popular for people to try to stand on a BOSU with the base up and do squats with the bar, do thrusters, right? They're doing squat presses, and that's because it was shown on social media. So I think it is important for us to be logical in what we do, and that's one of the reasons why we came up with the construct of just balanced confidence. It's a way of documenting progression for clients, as well as looking at motor control and can they stand on one leg for 30 seconds. So you can do a temporal assessment, how much time they're standing. So we have all these assessments and stuff, but like you said, is there has to be a logical progression that also reflects the client's goals and the SMART goals. And that's just kind of my humble opinion, because number one is, like you said, we're always on TV, and we need to be professional and progress people systematically so that other people can follow. But also, secondly, it also protects us, somewhat protects us legally, because we've documented it and we charted to say, hey, look, we've progressed them systematically through, and so I think that there's a lot to this study as we dig, and hopefully the future studies we do, we're going to be able to come up with a sort of like a protocol to progress the invisible objects, because as you know, Dr. Richey, is that this is an untapped area. We use these objects all the time. One thing is we even look at like TRX, suspension training. I mean, there's so many different modes of this kind of balance per se, but it's an uncharted area that's been used. We talk about it, research, but there's really no regressions or progressions, are there? It's very vacant. So that's one of my new lines of research, is to at least try to come up with some recipe, which our first thing is we looked at the brain, and now we're going to look at the nervous system. We're going to look at control, and we're going to try to connect those two so that we can at least come up with something for professionals to guide them and progress them through all these objects, and versus just the profession, the Fit Pro or the Allied Health Professional just picking an object and saying stand on it. And as you know too, in most rehab clinics, they're so busy these days, it's really the assistant that has to watch them. So there's a big gap. So we're seeing this gap in clinical practice, typical fitness, as well as the research, because we're not connecting the dots. So.
I think there's anytime you can systematize something, creates you when you can show progression and support people at a starting point. You brought up something that I think is really valuable, and it's not necessarily for you, but maybe something for us to look at for our community, which is the legality of things. And over the last few years, there have been more and more lawsuits that have been put forth against personal trainers and facilities. And I'd like to probably talk to somebody about that too, and understanding the value of a systemized, progressive means of getting from somebody from where they are to where they want to be in a safe, effective, and efficient manner. And to have you going in and doing some research on how to fill in the blanks on what that looks like with these tools is incredibly valuable. So thank you for doing that.
Yeah, thanks. And yeah, just a side note, I do some legal expert witness consulting. And there's been a few cases I've had this last year out of Arizona where mistakes were made in the area we talked about. So, and usually more so than not, the professional's too busy. They're not thinking it through. They're not focusing, and mistakes are made. Unfortunately, the intentions are good. You know, everyone has good intentions, but sometimes they book themselves back to back to back. It could be a physical therapist. It could be a chiropractor. It could be athletic trainer, a certified athletic trainer. It could be a fitness professional, but they just get too busy and mistakes are made. So exactly what you're saying is that if we have a more systematic way to work with all these very popular tools, maybe it'll help as a holistic approach for the patient and the professional, right? I mean, I know, who knows, right? We're still figuring it out. But I think these are great ideas because, as you know, too, and this is why you're doing the session at Optima, which of course I'm going to attend. It's going to be amazing. And, you know, and I want to see that. But this is an area that's kind of a hot topic because we're starting to see that, you know, we need to look at this area and address it because a lot of other areas are getting attention, like myofascial release. Like Kyle and I mean, we've exhausted every foam roller, you know, so I have like foam roll fatigue. So now I'm looking at, I know now I'm looking at this area. But yeah, I think this is a good hot topic for everyone to discuss and to check themselves, you know?
Yeah. Well, thank you for what you do, all the research that you do, from foam rolling to the regional interdependence model to now balance. A lot of that stuff we have, and your research and your studies have been quoted throughout our CES text. So thank you for all the research that you do, and now you're adding to it in a different area. It's much appreciated. Let me just real quick to Greg and see if we have either any questions or any housekeeping things that need to be addressed before moving on and closing up.
You guys did a great job and covered everything that people were talking about in the chat, so thank you for that. A couple housekeeping things. If you guys are interested in group fitness, anybody listening out there, we have an AFA live event going on at noon Pacific time today. That's Friday if you're listening on the podcast, that you can head over there. Angie Miller will be hosting that, and then make sure to join us again on Monday for another NASM CPT live podcast at 9 a.m. Pacific, noon Eastern with Rick.
Yeah, and our guest then will be my friend that I've known for almost 20 years, Pete McCall. So for any of you who know Pete McCall, he will be on, and we will be, first of all, catching up because we've known each other for quite some time, and then we will get into some additional topics specifically around aging and how high-intensity interval training helps to decrease that aging process and some of the science that shows the evidence for that. So with that said, Dr. Scott Cheatham, thank you so much for being here. Can you just give us any type of wrap-up you want, but also give us ways that we can contact you or follow you if you have Instagram or your social media, whatever it is, let us know and give it to us.
Yeah, I think just in summary, I want to thank, I thank you for hosting me and me sharing some information. And again, just, I just want everyone just to have fun with their clients, create a good experience. Use these objects for fun, excitement, but just have a little bit more purpose, right? And also just to be safe. I think that's the main thing. And everyone can Google me. My name comes up a lot. Or I have drscottwcheatham.com as my personal email page. If people would like to contact me there, or it's scheatham@csudh.edu is my university email. So people can contact me through there if they have any questions, or if they want to get, dig deeper in any of these topics. I'm willing to share. And then hopefully, we're anticipating Optimus going to be going, and I'll be there too. And with any of our family out there who are going to attend, I would love to sit there and have some coffee with you and chat and, debate on all these fun topics. So again, thank you so much for your time, Dr. Richey, for hosting me, and of course, NASM.
Excellent. Thank you so much, Dr. Scott Cheatham. My name is Rick Richey. You've been listening to the NASM CPT podcast and our Facebook Live webcast. Thank you.